Hello everyone, we appreciate you for joining us on another edition of our High Net Worth Personality Discussion Program on Ogtv. Hot Seat is the program. My name is Adeshino Anidube. As you may be aware, several Nigerians of high net worth have featured on this program. Today we have another of such Nigerian, somebody who plies his trade in the field of medicine but not within the shores of the Federal Republic of Nigeria. Our guest is the president of the Medical Association of Nigerians across Great Britain, Dr. Jacob A. Akoh. Dr. Akoh, you're welcome to the program.
Thank you.
Dr. Jacob A. Akoh is a consultant general and transplant surgeon at Plymouth Hospitals in the United Kingdom. He is also Associate Professor of Surgery, Honorary Clinical Senior Lecturer with the Peninsula College of Medicine and Dentistry, University of Plymouth. His current practice involves elective and emergency commitments in general surgery and renal transplantation. He is also listed in the Dictionary of International Biography and cited in the 2009 and 2010 editions of Marquis Who is Who in the World. Subspecialty skills include general surgery, renal transplantation, vascular access surgery, parathyroid, and thyroid surgery, among others. Our guest on the program today is a member of many medical societies and has published articles in peer-reviewed journals and is co-editor of a book on dialysis access titled Dialysis Access, Current Practice. He is an expert who, of course, has a lot of experience to his credit. Our guest is a member of the Training and Education Committee of the British Transplantation Society. He was until recently and until a member of Council of the BTS March 2011 to February 2014. He is in Nigeria to see how better he can impart knowledge to other professionals within the environment here in the interest of all. Again, we are pleased to have with us the President of the Medical Association of Nigerians across Great Britain, Dr. Jacob A. Akoh. Again, we are pleased to have you.
Thank you.
Today, it's time to talk medicine again.
Well, thank you, Shino, and I want to welcome our guest once again on the program Hot Seat. And well, what can we say than to hit the ground running, because we know it's loaded, it has a lot to let our viewers benefit from.
Dr. Akoh, no doubt you may be away from Nigeria, but you are not far from Nigeria in terms of being in tune with the realities of healthcare management in Nigeria. If I ask you to make an attempt of the entire system in terms of public health management, what would be your take?
Well, I trained in Nigeria at Ahmadu Bello University Teaching Hospital in Zaria, and I trained with the Nigerian Postgraduate Medical College and the West African College of Surgeons. Was a consultant surgeon in ABU before I left for the UK about 27 years ago. And until recently, had my parents in the village, and we have visited home regularly for many years, and in recent times have come home to Nigeria about 2 or 3 times a year. So I think that I'm conversant with what goes on here. I wouldn't think that I know as much as everyone at home, but I think I know enough to have an understanding of the system. Now, you asked about public health. You'd be surprised to hear that I think that the public health issues in Nigeria are paramount, and there are simple things that we can do to improve the health status of our country. I start with providing water, clean water for every citizen, and that's achievable under our current systems. Borehole technology is there, so where you do not have pipe-borne water or free-flowing water, you can do something to do that. And that would reduce our disease burden by half. But I'm sure you're going to ask me a bit more later.
Now, let's come down to the level of primary health care. I'm sure that also obtains in the developed parts of the world. The Nigerian situation, we were getting it right during the days of the late Beko Ransom Kuti. Koye Ransom Kuti, I beg your pardon. But I'm not sure that Nigeria can still stand tall among her peers today in terms of primary health care.
Well, you see, if you talk about primary health care, let's again move away from just medicine or health and talk about the things that make for primary health care. It is good housing, avoiding overcrowding, good water supply, reducing accidents and injuries at work, on the road. So there are all kinds of things that go into it. So when the government makes a budget for improving the lives of people, it's not just the amount voted for health that we should consider as being voted for primary health care. Now, in 1975, okay, it was deferred to 1977, there was the Akoh, the first tax ceremony in this country. And I remember in medical school then our teachers saying that the money that Nigeria alone was going to spend on first tax will bring clean water to 70% of Nigerians then. So we chose honor and dignity ahead of our health at the time. And I'm sorry to say that we continue to do the same even now. People tend to look down primary health care. But actually, in most of the developed countries, it would be a big scandal if the issues that make for comfortable living and healthy living are overlooked. If there was no water supply to a city today, there will be so many things that will be done to address that. If there was a big pothole where there was an accident and somebody died, there will be a huge outcry. So they take care of those things as of right. And therefore, the burden of disease due to infection is much lower than we have in our country. And the question is, where do we start from? Let's start from the basic things. We've got communication now, which is good. We need to address those issues that affect the generality of the population and take it hand in hand with other things we're doing for other aspects of healthcare delivery.
Now, talking about healthcare financing, what options are most suitable to a country like Nigeria?
Nigeria, unfortunately, is a country where people do not regard a lot of things done by government. They don't believe that you owe it to government to do your best and to produce your best and to show results for it. And if you're employed by government, you can afford to go late and expect no repercussion from it. If you're employed by the private sector, you know if you do not go to work, you may be sacked, and therefore you go to work on time. Now, having said that, it is said that at least 40% of Nigerians are below the poverty line. That means they don't earn enough to cater for themselves. And therefore, the government has a huge role and potential in financing healthcare. In our country, right now, 70% of the expenditure on health comes from private pockets. That's not good enough. Okay? The introduction of the National Health Scheme, which is taking so long to get going, may address this. But in addition to that, the very smart states are introducing community-based financing in order to have measures to ensure that the community can get adequate health care delivery. It is true, and in my convoluted way, I'm coming to the point that if it is managed not necessarily by government, but the government sets the regulatory framework for how things are done, then we may be getting good value for the money we spend on health or the money we spend on most things. So I would say the travel in the direction of National Health Insurance Scheme is good. Take a state like Lagos. The governor said that only 10% of the health institutions in Lagos were owned by government, which means access to healthcare is determined by how much you have and how much you can pay. And you can't change that situation overnight. But what the government then can do is to make sure that they regulate how this care is provided in a way that it doesn't discriminate against people. They make sure that even the insurance people you pay money to are properly regulated and held accountable for how they provide that service. They have a system for checking that the quality is good, and that way the population at large will benefit from the healthcare provided.
Okay, Dr. Akoh. Now, if way back in 1977, Nigeria traded health away by hosting Festac, which of course, as you said, submitted that the money expended on that festival will have fetched 70% Nigerians potable water. Now, 27 years you've been away out of Nigeria in the United Kingdom, still in the same medical line. How do you see us moving out of this doldrum of this vicious cycle of our medical service that we have not been able to improve in any way? Because with what you said, it's like Nigeria is not moving at all in any direction.
All right, let me very quickly correct the impression that we haven't improved. No, some areas have improved. Incidentally, I was at Asaba last year during the first National Health Summit, where I was asked to address our colleagues. And actually, because I trained the system and knew many of the people, we could relive old stories. Some things have improved, but unfortunately, many other things haven't. And in teaching hospitals or government hospitals, many of them, some of the situations we left are worse today than they were then. All right, tell me why it is justifiable in any hospital in Nigeria today where there's no power supply. Why is it justifiable that there's no water supply in a hospital? We're talking about Ebola, for example, and this of cleaning hands and doing things. And then yet you go to some hospitals in this land. Okay, it may not be in Abeokuta, it may not be in Ogun State, but in this land where there's no proper water supply. So when you hear that, when you see that, then you feel that we haven't moved forward quickly enough, and there's a lot to be done. And in fact, during that meeting last year, I put up one slide saying, look, we must call on government to make sure that power supply to health institutions, not to doctors' houses or nurses' houses, health institutions should be made a top priority. Because just like in the state, in Abeokuta here, if there's going to be power failure in Abeokuta, the governor will get power. The hospital must get power, because we have to realize that that person in the hospital may be your relation. That person who will die on the table because there's power failure when the doctor is going to make the most critical step in the operation could be your relation. We have to do it for the sake of all of us and value life. And therefore, there are a few basic things that the government has to ensure, and the people must demand that happen.
Okay, if all these are not yet in place, as you rightly pointed out, we then subscribe to the fact that maybe full privatization of the health sector will perhaps give us a leeway.
Well, we're not ready for full privatization yet, because our structures are not right for it. It has to be done in a systematic way. Don't forget, if you go to America, there's the outcry that there's no universal coverage for health in America. For emergency care, yes, but if you had some forms of other diseases, chronic diseases, and you were not insured, you couldn't be covered. In the UK, it's different, because the government ensures there is enough money voted for the healthcare delivery. They get the money through various taxes, but they ensure that the healthcare delivery is free at the time when you need it. And therefore, if you were denied it, there will be systems and processes in place to ensure that that is corrected, or if necessary, people are punished for it. So it has to be a mixture going forward. And there's, in a country like ours, every need, for the government to regulate it and make sure that even if you're a private concern providing certain health services, you were providing it to the standard required for what is acceptable quality care.
Okay, now with the various options that we have tried, in terms of interventions to really make sure that people have access to affordable and qualitative health care, do you think that those policies were actually conceived in the right way, or the implementation was actually the problem that we had? That, for instance, we have National Health Insurance Scheme, and we have series of that in the past up to date, and yet the health system seems not to be improving.
And there are two sides to the question you're asking. The first thing is this: if you go to the Federal Ministry of Health now, there will be loads of policies. We're very good at making policies in Nigeria. I think the key issue is implementation. There's no follow-up on implementation. There are no sanctions for not implementing policy. And sometimes the policies, people don't even know about them. So that's number one. We have to go away from having too many workshops to make new policies that people will forget the next day, to actually saying what are the key issues that this population, this community need. What do we need in Nigeria? Now, the second aspect is that we're not taking our health seriously enough. And that's why we've been talking about it for so long and not a lot is happening. Unfortunately, that's why we can afford to sack 16,000 doctors in this country and allow them, when they could be back to work, to still stay out of work for another week after they ended their strike. I'm not just justifying the strike, but I'm saying the government cannot afford to do that. We don't know how many people died because of the doctor's strike. We have to look for a way of making strikes irrelevant. But at the same time, the health bill took a long time to pass. And even now, right now, the president hasn't signed it yet. The health insurance scheme, we've been talking about it for many years. But if you look at the law critically, it's still not very accurately and effectively policed. We need to tighten it and make it work. And we can look at Ghana, that started not too long ago, making inroads. They mapped the whole country. I go to Ghana frequently to offer medical missions free of charge, and I'm very impressed by the way they do things there. So we can facilitate the process and make it quicker, so that we can actually have effective health insurance that will be commensurate to your level of wealth. So someone who is in the village who is not generating wealth shouldn't be expected to pay the same as someone like you in order to get the same level of care. And that is being your brother or your sister's keeper. But done in a way that it's open, effective, justifiable.
I know that you are the president of the Medical Association of Nigerians across Great Britain, and that means that there is high level of exposure to best practices in healthcare management or delivery, as you like. Here in Nigeria, we cannot say that your colleagues here have that of competence, but exposure to requisite environment will be the major problem they have. How then can we facilitate a win-win situation between those who are local practitioners here and those of you who are from here, diaspora Nigerians, plying your trade elsewhere, so that your own knowledge and exposure can rub off on them?
Well, earlier today, I stated that one of the reasons why we were coming here to train and to work with colleagues from home to train the doctors for tomorrow is to make sure that we are getting the benefits from both sides and seeing what is relevant to Nigeria in order to improve our system so that the quality of care we produce here is better. I give you one key example that most people are not taught in medical school, and it's called clinical governance. Being responsible for your action as a doctor or as a nurse or as a health worker. What are my responsibilities if I'm treating you? How can I be judged to show that I'm actually carrying out those responsibilities? Am I knowledgeable enough to sustain my claim that I'm a consultant, surgeon who does X, Y, and Z? How do I update that knowledge? How often do I show evidence for it? And when things go wrong, how do I right them? And does anybody actually check the work I do to make sure that I'm as good as the others, average, above average, or whatever? In many advanced countries, they have systems like that in process. That is very rudimentary in our country at the moment. But it's something that I think the profession realizes is required and necessary in order to move us forward. That medicine is no longer to be practiced the way it was done 40 years ago. When you finish medical school, you are the doctor and you're next to God. No, you have to learn. It's a life learning process so that you are constantly processing new information, putting it into the situation of the person you're treating to make sure that you're doing your best for that person. And it really goes back to our Hippocratic oath. Now that goes on, and part of our interaction with our folk here, with the Nigerian Medical Association, with centers that would have us, is to make sure that we are networking, cross-fertilizing ideas, encouraging good practice so that we can bring some of the improvements we see elsewhere back home, so that what you call the brain drain becomes real brain gain. And that's part of the reason why we're here. And we've not come because we feel we're superior, but there are some benefits from seeing things done differently elsewhere that you can bring to your own home.
Okay, is it not an avenue for you to equally capitalize on the brain drain syndrome? Because there was a period in Nigeria that trained Nigerian nurses were moving in droves to the United Kingdom and other parts of the world. Until today, that has had adverse effects on the medical practice in Nigeria, and that is why a lot are not happening. Don't you think that this will continue to rub off on the development that we are craving for in the medical sector in Nigeria?
Well, it may well be that we have to bring another law here, human rights law, into the equation. Now, what the responsibility is for the government, for the people, is to make sure that we create conducive environments and conditions to retain the people we train. You have the freedom to go anywhere you want in the world. If in this country you have whatever you need and you have access to it, you wouldn't want to go. When we were in medical school and junior doctors in this country, many of the people who were sent abroad came back 3 months earlier because they felt the condition in the country was better than what they were exposed to abroad. It's the reverse now because of the economic issue, and I'm not saying everybody is an economic migrant, but people have gone for all kinds of reasons: school for children, enhancement of their profession, the ability to carry on doing very fine work and high research. And like I said earlier, people are at various levels, and there are many Nigerian doctors at the highest level in the UK and in America, and so it's a complex one. But what I think is pragmatic now is that you've got people who have gone to acquire something that is not available here. If those people are willing to come back, to join forces with the local force, and that's why working together is good, collaboration. In order to make it better, we should welcome it rather than turn a blind eye to it.
I want to ask of what options are before a patient in cases of wrong diagnosis or treatment that is actually below what is recommended in terms of standard. We've had instances of high net worth Nigerians, one or two possibly, presently in the past, who had been wrongly diagnosed. What should a patient who finds him or herself in such a situation do, or what are the options before them, both here and elsewhere?
Okay, I think that the first point I want to make is that no doctor is infallible. No system is infallible. No equipment for making diagnosis is infallible, especially if the reports or records are read by human beings and interpreted by human beings. Okay, that's the first point. So anywhere in the world, it is possible that there will be error, medical error. Right. What's important is the system we have in place for dealing with that. Okay? Right. So if, for example, in the UK, you had a wrong diagnosis, you would write a letter of complaint which will be taken seriously by the hospital. They will investigate it, give you a report. If you're not happy, you would go to a higher level beyond the hospital to the ombudsman, and they will look at it. If you're not happy, you will sue the hospital and you'll get response. If, for example, a doctor was found to be doing things that are unorthodox or they're dangerous, that doctor can actually be prosecuted. So there are safety mechanisms in the system. Okay? If you did not greet your patient well and the patient felt you were hostile to, the patient can complain. It's called the patient charter. So the patient has a right to know what's wrong with him or her. You have a duty to explain it to that person. So it's no longer the old system where you couldn't ask your doctor a question. So if things did not work well in your experience, you raise it for two reasons. One, so that it can be corrected. Two, so that systems can be put in place to avoid it. Okay? Now, in our country at the moment, somebody may even commit a very serious crime and still avoid punishment through bribery and corruption. And I'm not saying there's no bribery and corruption elsewhere. There is, but it's the level. And it's whether when it's found out, what happens. If the Prime Minister gives bribe and it's not found out, obviously he won't be punished. But if it's found out, he will be the first to resign once the public knows. What would happen here?
The order of the day.
Okay, so that's the point. And now, and that's where clinical governance also comes in. We need to have a system for interrogating our way of doing things. If in the Federal Medical Center, Abeokuta, everybody who has a hernia operation develops an infection, something is seriously wrong. You now go there and say, what are you doing wrong? How does that compare to what's happening in Lagos or Ibadan or in Abuja? Why is your infection rate 100% and not 5%? Okay? And then you put a system in order to deal with it. And you don't stop there. You come back next year to find out what the infection rate. Then you come back next year, it's 30%. Oh, well done. It's good, but not good enough. What are you not doing to the satisfaction of everyone to bring it down to 5? And that's how to improve the system and build confidence in it. And that will come when people are monitoring their own work, the result of the work they do, and are listening to what the people you're treating are saying. Now, what needs to change.
Now, with your very competencies as diaspora Nigerians who are established in medicine, does the government actually give you consideration in terms of engagement, let alone listen when you speak to government, so that at least what you see out there can be replicated here in the interest of all?
MANSAG, the Medical Association of Nigerians across Great Britain, has a memorandum of understanding with the Federal Ministry of Health. And for that reason, along with our sister organization in America and in Canada. And for that reason, we meet regularly. And I say that with some equivocation, in order to oversee some of the agreements and to help with what the government is doing. 2 years ago, the federal government wanted to regularize or regulate better medical missions to this country. We held meetings in Abuja, and I, in fact, was the chair of the group that went to write the guidelines for Nigeria. Hopefully, at the next National Council on Health, that will be passed into law. So, we're helping the government with policy, we're giving advice. How much of it is taken is anybody's guess, but we will provide whatever services is possible to provide. We will make comments on various things that the government is doing or planning to do if our opinion is asked. And quite frankly, if our opinion is asked, we will do a lot of research to make sure we avail whoever is asking our opinion of our best understanding of the subject. We're working with the Nigerian Medical Association too in that regard. Last year they would have consulted us about 10 or 12 times on various issues that we're working behind the scene to improve or to support people here as much as possible. So yes, we are trying.
Ebola is one issue that is actually ravaging humanity at the level of West Africa, and by extension maybe some fringe individuals have also contracted this outside of the West African sub-region. Is there the possibility of a steady or sustainable collaboration between you and your colleagues back home here as to the emergence of any vaccine or anything that could assist in taming the tide of this virus?
Good question, and difficult question if you're talking about Ebola specifically, because as you know, Ebola is not a new disease. It's been around for some time. And right now, the most advanced vaccine is being produced in the United States. Complex financial arrangements, whatever. And there are people who have all kinds of ideas about that. I'm not sure that virus like Ebola is something that you want to say the nation has to set out to develop. But the nation has to have a culture of good research methodology, good national research, in order to position herself in a place to produce vaccines or to lead on the development of national or international emergencies like Ebola. And that takes us back to funding for our National Institute for Health Research. What type of health research do they practice there? What is the outcome of the health research practice there? How is that influencing policy in our country? How is it influencing education in our country? What level of support is the government giving to it? All kinds of questions. That's where to start from. Then, if a Nigerian brainy person comes up with a new vaccine or a new solution, he will be celebrated worldwide.
Well, okay, Dr. Akoh, now let's take a look at what has become the order of the day in Nigeria today, particularly when you take a look at public workers, even to some extent, maybe civil servants and the rest. And of course, I know in your professional medical line, it is unethical for a medical practitioner or health giver to say you are going on strike, because you are more or less providing intervention, as you said the other time, that you are like next to God, because we have to save lives here on earth. Now, but it has become order of the day so much that if your demands are not met, then the next thing to do is to go on strike, thereby deny people, and as Riley said the other time, people in the rural areas who do not have the wealth to have access to quality and affordable health care will now suffer for it. Do you think this trend should continue just like that? Because they just came out of a strike just a few days ago from July 1st, and it was suspended just towards the end of last month. And that to me will not be the end. We may likely see another one coming up very, very soon.
Right. A complex question, one that is dangerous to answer, but I'll try and give you an answer. The first thing, which is more important, is why does our society allow strikes to happen? Right, so you've got the medical profession who have their responsibilities and duties. You've got currently the government that has her own responsibilities and duties. Okay? Let's just leave the private sector out of this for a second. Strikes would happen because there's a breakdown in communication, either because somebody is too proud or too foolish, yeah, or because promises are not kept, or because the demand is unjustifiable. It could be any combination of this. Okay? Strikes to say improve our pay come because we don't have a proper system of regulating pay in the health sector, in the society. If you take the United Kingdom, for example, salaries are determined by an independent body. So it's not even the president telling them this is how much you pay X, Y, and Z. Independent body will factor many, many issues into deciding what you're worth at this level and what you're worth when you've trained to this level. Okay? Even the idea of increasing your salary on a year-to-year basis relative to inflation is determined by an independent review body, and the minister then goes to parliament to defend the decisions that have been made. So it's very few and far between that you find government intervening directly. And when there are disputes, the system is such that the government can be held accountable. It's not that the governor is above the law. if you go to court and the court that is staffed by people who are relevantly trained can question the governor and hold the governor accountable. Without that system, we are therefore left to jungle justice, in the sense that, well, if you don't meet my demand, I'm going to slap you. I'll slap you today, I'll slap you tomorrow, I'll slap you next day. And so when two elephants fight,
they cross.
Which is unfortunate. Now, having said all of this, I believe fervently that we should now progress to a point where society does not tolerate strikes anymore, and that strikes are made irrelevant.
How can the society achieve that?
Society hasn't learned from past mistakes. I don't know how much time we have. I could tell you the story of what happened in the 80s in this country.
Please go ahead.
After strikes. Okay? All right. If you say I should go ahead, let me give you two examples. Up till 1982 in this country, the health sector was well provided with facilities. The vote, the percentage of the GDP, and I know the GDP for Nigeria has been recalculated, was much higher. Okay? By 1982, many of us doctors in the system noticed the change and called on the leaders in the health sphere to notify them. We were falsely assured that things would improve. We called our CMD in ABU to a meeting of resident doctors, because I was one of the officials, so I can tell you firsthand. I said, don't worry, things are not that bad. Then, a few years later, if you were involved in a road traffic accident, you came to the hospital, you were asked to go and buy IV fluids, antibiotics, and the drugs that will be used in your management. God save you if you were unconscious. Because literally in the hospital we didn't have any reserves. If you came with appendicitis, you were given a list. So as resident doctors, we decided to go on strike to force the government to improve supply to the health sector. That's good strike, because what you cannot quantify is that how many people died because of that practice. How many people would have died if that continued? Nobody knows.
Yeah.
Okay? Right. If the doctors went on strike under that system, asking for improvement of services, not for salary for themselves, this is what was different about 84, then you couldn't terribly blame them, because if within the 48 hours of the strike, and that's if they responded, a few people died, it would be like what happens in wartime. But for you to have a strike that lasts for 6 weeks is irresponsible on all grounds, of government, of us, the profession. There are things we can do differently. We must never allow that to happen. And I'm not just saying that, because in 2012 the British Medical Association declared a strike. It wasn't uniform like here, but it lasted for less than 24 hours. Okay? So the society, how many people in the sectors in the society rose up to ask the government to end the strike by whatever means necessary, not by force, not by decrees, to say what are the real issues? Okay, you doctors are right here, you're not right here. How many House of Assemblies in the states in this country did that? Why do we not think we have a responsibility to the people to protect them? And that's what you can do to improve it. How many people here went to the medical director in the Federal Medical Center and said, look, what actually is the reason for this strike? Come and talk to us about it. What can we do to cause the parties to come together or to end the strike? So that's something we can do. But beyond this, it's about having a structure within our society that takes some of those functions out of government into people who are trusted by society to be independent and who can actually give a fair judgment where there are disputes. And also about looking at our laws to improve them in order to ensure that I know if I'm taking up a job as a consultant, if Dapo invites me tomorrow and I come to work for him, I know exactly what I'm going to be doing for him. And if we agree that I'm going to do 50 transplants for him in 1 year, if he provides X, Y, Z, and I don't do that, then I'm not meeting my commitment. And if I do that or beyond that, then he should reward me.
So what actually is the problem here? Is it a problem of a leadership that we are having that is giving us all these challenges that we are confronting the nation, or that the followers or the populace too are not doing enough to assist government?
All. If you travel on the road from here to Obasanjo Resort, there are a few potholes on the road. If you have an accident and die, they will say, oh yes, it's your time. It's not your time. It's that the road was bad, and maybe the opposing driver can't see very well. It's not been tested, or can't read the signs that say slow down. So all kind of factors. And so the public needs to know their rights. It's not enough to say, let's go to the road and pray so that there will be no accidents. It is enough to say, Ministry of Works, make sure there are no potholes in Abeokuta. It's enough to say, police on the road shouldn't take bribe. They make sure prosecute badness so that people do the right thing. So the public needs to know her rights and demand her rights. The public need to be treated when they are sick, and so if they're not getting that, they should hold whoever is responsible for ensuring that to task. That means the people say, Governor, you're supposed to make sure we are treated when we are sick. Why are the doctors not there? Well, you're supposed to tell the doctors, you're meant to take care of us. Why are you choosing X over us?
Okay, Dr. Akoh, I wouldn't know the last time you were in Nigeria, because you did say that you visit Nigeria almost 3 times annually. Now, between April 14 and now, if you are to calculate that, that should be around going to about 194, 195 days. The state of insecurity in Nigeria, what went through your mind when you were coming for this conference to impart this knowledge on your colleagues back at home? Because some girls were kidnapped April 14, over 200 of them up to today, not a single soul has been rescued, and yet we have government at various levels in this country to take care of citizens, as just as you have said, that you are to look after these citizens. You have been entrusted with their welfare, whatever, but yet contrary is what we are getting.
I was actually in Benin in April and came back to Abuja early May, the day after the bomb blast in Abuja.
Yeah.
So I was close to that fire.
Wow.
Yes, I'm aware of the risk, and we explain risk to patients every day. If I'm going to take your organ out, I'll tell you what the risks are, what the benefits are. I won't go into politics here, because I'm sure that's not what you want me to talk about. I have my views, but from the medical and attitude point of view, yes, I know that it's a lot more difficult to visit Nigeria or some parts of Nigeria than it used to be. And we have to recognize that that's a factor, that the security situation is a factor. This conference that we're holding in Abeokuta today, we wouldn't, if it was in Maiduguri, we wouldn't go. It would not be reasonable to send people there, not to talk about going yourself. So the government obviously has the responsibility for our security, and whether they are doing a good job or not is an open question that people have to answer themselves. But yes, we can do a lot as a community to make sure that the security situation is addressed. We can hold the government to account, and we can do what we can to help the government to achieve that. You mentioned the Chibok girls. Only God knows what is happening to them, or what the issues will be when they are released, what their health issues are. And I don't know if some institution in Nigeria is already looking to address that. The psychological, psychiatric issues that will come up, the infections that will come out, the personality changes that will follow it, even diseases within their family because of this separation, all kind of things that are complex. I hope that somewhere in this country the government has commissioned some people to look into that so they can provide good advice when the girls are eventually released.
Now let's talk about medicine at the level of training for undergraduates. I know that we're talking about the need to ensure consistent upgrading of practitioners' knowledge and competences at the level of training for those who are just upcoming in the practice, undergraduate doctors and so on and so forth. what it used to be in those years, is it still what it is?
I'm sure you know the answer to that question.
I will recall that a lecturer will still bring out a note he used some 10-15 years ago, will just dust same and tell you this was what I used 3 years ago, 4 years ago, 5 years ago, and still expect modern trends to come to play.
I hope that doesn't happen, but recently Mansag, in addition to AMQA and many other people, and the Federal Ministry of Health, QA, and people from the Ministry of Education came together to look at the template, the curriculum template for our medical schools in Nigeria. Because the one that was being used up to that point was antiquated, also about 50 years old. There are many good ideas in that template, which was largely based on the Ibadan template, the current Ibadan template. And I understand now that there have been several modifications of that because of all kind of issues, whether political or otherwise, between the NUC and the ministry. But we're being reliably informed that before long the new template will be released, which will set out the way training should go on. What it doesn't do is to actually improve it for you. You have to then take action to get the right staff and to teach your students the right thing and to mold them the way you want them to follow your DNA by the time they finish their training. But there's a lot of resource out there that anybody wanting help can be helped with. In Plymouth, where I work, medical school is 11 years old this year. Within the first 10 years, it's become one of the 10 best medical schools in the UK because they adopted a new technique of learning, of assessing people and of helping. And today I heard that the university here wants to have a medical school linked with the Federal Medical Center. Well, if they need help, they should look for help in the appropriate quarters. I'm sure it can come.
Now, when we have personalities like you on this program, we want to actually put them to task with respect to what they think they would do. By chance, they are at the apex level of authority in their respective professions. As an established medical practitioner, by chance you are the Minister of Health for this country, what are the priorities you would have?
I hope Chuku is not listening.
If he does, you never can tell. It could come. You qualify for it.
I won't be presumptuous. I'll say at the time I am, and this is all hypothetical, what will be the prevailing issues in the country? Because if you take too many things, you don't achieve anything. You have to be focused and say, if the president calls you up, you say, all right, what do you want me to do? These are the issues. There are 10 issues. We can't achieve all 10. So, what are the key issues? Let's identify 3 or 5. And then with these 3 or 5, we will find the best brains to find out the best way that is relevant to our country to move it forward. Things that are measurable, things that are simple, things that can be done to improve the healthcare delivery system in this country. That type of structure is what I'm used to in whatever responsibilities I've taken in the past. And I would recommend that to anyone who is given a position to change things in this country, change things for the better, or to improve things, or to modify things.
In recent past, there had been agitations for diaspora voting in the nation's electoral process. By chance, the just concluded national conference gave you that opportunity. Will you be most willing to say, okay, why not? From my own base, I want to see how I can vote for this, vote for that. Or are you also against the call for diaspora voting?
Obviously, I won't be against the call for people in diaspora to vote because they feel they're Nigerians and they want to improve or influence things that happen here. Most people will want to do that in order to improve it. So I think it's a welcome development. But the bigger question is, the vote you cast, does it count? Does it count nationally, everywhere? So let's make the vote count. Let's get people to vote. Let's hold people accountable for what they ask us to vote for them about. That way, we'll be taking a huge step forward.
Okay,
so that we're costing home.
All right, thank you, Tino. Dr. Akoh, if you had to make a comparison will you say that Nigerian doctors, medical practitioners are anywhere near those that are in developed countries?
Unfortunately, I don't make such comparisons because I don't think they're useful. The point I'll make is this. It depends on your training, your experience, and how you've been improved. Okay? So, it's not about saying, are there good doctors here or not? What's the attitude? What's the training? How was the application? If I take you from here to another system and you're given enough induction, can you function well? Okay? When I left Zaria to go to Britain, I knew my stuff. Okay? Because I was a consultant here before and I was very experienced and we had a good grounding, I could stand tall anywhere. And I'm not boasting. Now, but that's not the situation with every Nigerian who has come. Therefore, I don't think that comparison helps us. What helps us is that we have to have systems in place for doctors working in our country to be improved on a regular basis so that they can face the new challenges that come up here. When my aunt developed stroke, I want the guy managing him to be up to date with it. Okay? When my friend is lying in hospital with XY, I want the doctors taking care of him to know what they're doing. The nurses taking care of him to know what they're doing. So it's not just about improving health for improving health's sake. We all benefit from it. And that's the focus. It's not about comparison. Such comparisons that were in the air when some notable figure departed, for me, are academic. They are of no use. They don't help anybody.
Actually, I asked the question because we discovered that in Nigeria, those that are supposed to effect changes still do not stay back here. They still go back and they go abroad to seek for medical interventions over there. So that's why it calls for worry. That is it the problem of personnel that we have in Nigeria, or the equipment, the infrastructure are not there?
When I was in Edinburgh many years ago, I was having to operate on Nigerians with very simple problems, things they could have had done here. But that's not the point. There's human rights. If you're paying from your pocket, you can go anywhere you like. Okay? Because at the same time, my friend's wife had a cesarean section in Lagos and died. Okay? So if my friend had money to bring his wife to have a cesarean section anywhere, this is a call. But if you're spending government money, then you're accountable to the people. And it would be unjustifiable for us to spend government money to send people elsewhere for treatment that could be obtained here. I could tell you another story from my time here when I operated on somebody very close to government, and he survived the emergency operation, and 3 to 6 months later he needed to have endoscopy. Endoscopy is when you put a camera down, flexible endoscopy, down to look into the stomach. And ABU didn't have one at the time. And it would have cost maybe 5,000 naira then to buy us a new one. But somebody who I won't mention on this program, who was very high up, said, we should send the guy abroad. Okay? So that's the attitude we need to deal with. If it's government money, let's spend it here. It's just like education. Let's improve our schools. Let's improve our hospitals. Let's build hospitals that can deal with all these challenges we have, so that you can, if necessary, fly specialists from abroad to come and help you, rather than sending patients. It's a national problem that we need to address.
If I ask you of any possibility of your eventual return here, what will be your response?
I won't tell you on air.
I asked that question against the backdrop of the fact that there have been calls to diaspora Nigerians by the government repeatedly that you should return home. The country is more than ready to welcome you back.
I don't think the government says that. First of all, I can very eloquently quote Chief Obasanjo. When he was president the second time, he came to London and said, I'm not asking you guys to come home. But he asked us to do a number of things, including sending money home, including coming home, including... It's not necessary for all the Nigerians abroad to come home. One, you won't have the jobs for them at whatever level. Two, And you may even lose some benefits of their being there. There is economic benefit that they are there. And we also benefit in other ways. Having a ready resource if we're actually willing to accommodate them. Because there's a growing number of people who are willing to come and help. And if you wanted somebody on a special occasion or treat or whatever, you can do that. There's absolutely that freedom to do it. But everybody doesn't need to come back. Incidentally, I was telling, I don't know whether it was Dark on our way here, that a few years after I went, I actually wanted to come back. And then came to this country and went to 7 centers, both private and public, and then gathered enough evidence to decide that on a personal level, on a family level, it will not be the right decision then. I'm not going to tell you what the right decision now is.
Now, we have politicians in politics. We also have professionals in politics. Any possibility of Dr. Akoh as a professional in politics?
A technocrat.
I think that the likes of Dr. Akoh may not even win a vote in Nigeria.
How do you mean?
I'll have to break down to you what it means to stand for election, and it means to convince people to vote for them. You know what obtains.
No, I don't.
All right. So I think it will be very difficult. But having said that, there have been governors in this country who came from abroad to help. I can give you a few names if you want, and in some instances they did very good work. So it depends on the situation. It depends on what you're coming to do, what particular position you're coming to hold. So,
Dr. Akoh, it appears you are firmly rooted a bit in politics. Nigeria is just about 4 or 5 months away from transiting from one civilian administration to another. What is your take on that? Do you see the democracy that we have started since 1999 gaining more ground?
What I'd like to see is what happened in Ghana, where a civilian administration of one party handed to a civilian administration of another party. That means elections were free and fair, and there was no undue influence from government to ensure that they won at all costs. I'm not saying if this government is running they shouldn't win, but I'm saying the situation should be such that it is free and fair. Okay? So that's what I would like to see. People are going around banding dividends of democracy, and sometimes they don't define what they mean. If democracy means you can challenge your leader to do something better, then it's good. If it means once he gets into that position he's God and you have to worship him in order to get the crumbs to eat, then it's bad. I don't belong to the camp of worshiping anybody. And therefore, I feel that people who put themselves forward to serve the public are servants. And Jesus Christ said, the servant is the greater.
Dr. Akoh, we cannot thank you enough for your time with us on this program.
It's been a pleasure.
We wish you and your colleagues the very best.
Thank you.
The provision of healthcare.
Thank you.
All right, thanks for coming, sir. And I hope on a parting note, your children, I hope they are still in touch with Nigeria. 27 years outside the shores of Nigeria. So are they in tune with Nigeria? And
I can say that in the last 15 years, we come home with the children every year.
Yeah, all right.
That's great.
So they have friends here.
So on behalf of everyone, we want to sincerely appreciate you for your time with us on Hot Seat. See you next week. Bye for now.
Thank you.